All right, everybody. Evan Benton, Dogg from Air, coming to you live in your eardrums. And today we're going to be looking at the shielding approach document from the CDC. So let's just bring that up right now. And here we are, interim operational considerations for implementing the shielding approach to prevent COVID-19 infections in humanitarian settings. So right away, what is the shielding approach? Basically, we're talking about preemptive quarantining. We're identifying people who are high risk, and we're giving them a little safe space away from the microaggressions of the world. Okay. Of course, high risk in the case of COVID is going to be the elderly and immunocompromised, and low risk is going to be everybody else. Hint, hint there. And we're talking about three different levels, okay? Household, meaning you just have, well, I'll get down into the level. Household, neighborhood, camp, sector, or community. And people are sending this to me because they think that it's more evidence that they're trying to round us all up and put us onto camps, okay? And that's not the case with this particular document. This is actually focused on camps, okay? Focused on camps, displaced populations, and low resource settings. So it's for refugees is what this is all designed towards. But it doesn't come, the evidence, quote unquote, for this approach does not come from refugees. So that's going to be interesting, and that's going to be at the very end. Current evidence indicates that older adults and people of any age who have serious underlying medical conditions are at higher risk for severe illness. They're really the only ones who are at risk. So we're separating those people, all right? In theory, shielding may serve its objective to protect high-risk populations from disease and health. However, implementation of the approach necessitates strict adherence to protocol. Inadvertent introduction of the virus into a green zone may result in rapid transmission among the most vulnerable populations the approach is trying to protect. Yeah, so this is a terrible idea. This was actually implemented in real life in New York State in 2020, and this is why good old Cuomo just today resigned. Of course, they blamed it on a sexual abuse scandal, which I'm sure he's also guilty of. But regardless, 40% of the deaths in that first wave came from elderly people who had been quarantined in nursing homes under such a rationale. Now, I need to look into it. I believe those people who were quarantined had actually tested positive, so it's a different approach, somewhat. But it resulted in a massive, massive deaths, and Governor Cuomo is a mass murderer, and now he's going to get off scot-free because they threw him under the bus with that, get out of manslaughter free card that is, his little sexual abuse or whatever scandal. One other problem with what we're getting at already is introduction of the virus. Okay, recent news out of Alberta, I'm going to be covering in more detail in another video, has shown us that they can't actually prove that there is a virus. They can't prove that the coronavirus actually exists, let alone that it's the agent of this disease that we're being told is called COVID-19. So a big problem for that, for proponents of that theory coming out of Alberta in the form of facts. But in general, this is a really terrible idea. Okay, putting all your eggs in one basket, because yeah, if one person gets sick, you've basically destroyed the quarantine approach. If a person in the quarantine gets sick, you no longer have a quarantine. So it's way better to have, we'll just get into it, many household level quarantines than to have one camp sector level quarantine. So pretty self-explanatory here. household level means you have one house, one family, and one low-risk member who just has their own room and preferably their own, bathroom and shower facilities. We're going to get into that later, though. And then neighborhood level, this sounds just batty. But remember, we're not really talking neighborhoods. We're talking refugee camps. So within 5 to 10 tents, I guess they would be, households. Yeah, you nominate one of those to be the green zone, and then everyone who used to live there, you swap those amongst the others. Just sounds like a really bad idea to me to ask those people to do that, but that's what they're planning at the neighborhood level. So neighborhood level, probably the least tenable of these three. And then finally, out of an entire camp, you would designate one area of the camp to be a green zone. One entry point is used for the exchange of food, supplies, blah, blah, blah. And then a meeting area for people to go between is there, while practicing physical distancing of 2 meters. Thank goodness. No movement into or out of it. Now into the more detailed considerations, and this is where I think that we are just phoning it in. God bless them. With a lot of these documents, suggested prerequisites, okay? So we're suggesting that each green zone has a dedicated latrine bathing facility. The idea that this is a mere suggestion is why I say this. So just as an example, we have 2 cars going down the road side by side at the same speed. The likelihood of one of these cars suddenly veering and smashing into the other car and causing an accident is very, very low for obvious reasons. Most accidents occur at intersections. So when you have 2 cars, both attempting to go through the same place but going in different directions, that's going to cause a lot of opportunities for dangerous interactions between those cars, okay? And just like that, you're not going to get sick just walking down the road. You're not going to get sick just, taking notes or something at school. You're going to be sick anytime you are putting something into your body. So like when you're touching something and then touching your mouth. Classic examples would be the doorknob at the bathroom, or the shared handle at the salad bar, okay, that other people have touched. It's where we have these interactions between different bodies and bringing things into your own body. That's when you have the opportunity to get sick, okay? The opportunity to introduce pathogens into your body. And as I mentioned already, this might not be a pathogenic disease. COVID-19 might not be a pathogenic disease. In fact, the evidence is looking more and more like it's not. But still, we're talking about just basic hygiene here, folks. Okay, and this is interesting. The shielding approach advises against any new facility construction to establish green zones. So we're really talking about interim facilities, okay? Just an interesting point there. To minimize external contact, the next one, each green zone should include able-bodied, high-risk individuals who are able to go back and forth and who have recovered from COVID-19 and are assumed to be immune. That's interesting, huh? And this is July, this article, July 26th, so we're talking about that. But don't worry, they're going to cover their butts here. Currently, we don't know if they can actually, become immune. So, the old canard of asymptomatic spread. So caregivers, right? We're asking members of the community to provide caregiving. And here, these kinds of standards we're talking about, these exist, all right? This is not just something that came out of the blue. Nothing with COVID-19 has come out of the blue. This has all been workshopped, and they've had these types of approaches. We've known about washing our hands. We've known about points of spread, and So this has all just sort of been cobbled together ad hoc from all these different sources, in a pretty poor method, pretty poor application if you ask me. But again, the actual risk of COVID-19 is really, really low. The actual damage that it's actually doing to the community is extremely low. So to that extent, it's appropriate. Next, though, we're going to monitor and evaluate the implementation of the shielding approach, okay, using dedicated staff. So this is where they really show their true colors, okay? They show how they really feel, okay? We're asking members of the community to provide caregiving, but here we're going to have dedicated, CDC or UN staff to monitor, all right, and if feasible, to minimize movement in and out of the green zone. So it's more important to make sure that you're complying, that you get good treatment. And that's exactly what's wrong with the whole approach. And here we're just getting into, I'm going to skip these, just showing how hard it is to implement all these different diseases, okay? All these different communities. And then minors have their own, right? High-risk minors have their own needs. And then green zone shelters should always be kept clean. And again, we're having high-risk individuals responsible for that. We're asking members of the community to step up. And the understatement of the century here, maintaining hygiene conditions in communal facilities is difficult during non-outbreak settings. The old tragedy of the commons here. But we're not gonna step up and provide dedicated staff for that because we're too busy just monitoring, right? So never mind the fact that garbage is going to pile up, cockroaches and rats are gonna move in, and they're going to be spreading all kinds of different diseases. No, we just have to monitor the fact that people, are you coming in and out? Are you where you should be? It's absurd. But this is throughout history. You go back to what they were saying about typhoid vaccines during World War I. It's the exact same thing. They were more worried about vaccinating troops than they were getting troops access to clean water, which they knew is what the cause of typhoid was. And then they had the Spanish flu epidemic. Is there any wonder? And then finally, green zones should be more spacious. Sure. Interesting, though. Even at the cost of greater crowding of low-risk people. Excuse me. Additional considerations. So we just have, yes, different groups of people. You have to worry about that. It just becomes more and more ridiculous. Timeline considerations we've got to read. Talking about 6 months. And why? First of all, we can have sufficient hospitalization capacity, which we have in the real world right now. The hospitals are not being overrun. An effective vaccine or therapeutic option. We have therapeutic options. And finally, the COVID-19 epidemic affecting the population subsides. I'm just going to show you this just to keep us all honest. And sorry for the broken screen, but we're at, right now, 1 death per 100,000 people per 7 days, okay? To me, the pandemic has subsided. I don't know how much lower we can expect it to get. Well, this is fun. Protection. Separating families and disrupting and deconstructing multi-generational households, you are here, may have long-term negative consequences. So yeah, we've been doing that in the Western democracies for generations, right? We're way down the road into single taxpayer homes, or however you want to say that. And of course, shielding strategies need to consider socio-cultural gender norms in order to adequately assess and address risk to individuals, particularly women and girls. Now, if you didn't know this, the United Nations, which CDC is drawing from here, no longer will give you food if you're a man. If you need food for your family and you're in a refugee setting, you have to be a woman. And they've come up with all sorts of cockamamie, fake studies to show you why this is true. Because, of course, men, if they're given a bag of rice, they will go and gamble it away and try and get motorcycles and things like that. And of course, women will not. Women will just take it to their families because they're responsible. Particular risk for gender-based violence, blah, blah, blah. So I'm not too worried about this document, but it's just another excuse for them to implement their social justice strategies. Potential disruption of social networks. Here's another thing where you are here. Community celebrations, funerals, and other rites of passage are cornerstones of many societies. So that's another thing that's, of course, been affected. And then mental health. Yeah, good luck with that. So anyway, summary, basically everything I've just read, okay? Household level shielding seems to be the most feasible and dignified as it allows for the least disruption to family structure and lifestyle, critical components to maintaining compliance. So this is good. It's good that they're indicating this. Of course, that's true, and if they had done that in New York State, many more old people would still be alive. However, it is most susceptible to the introduction of a virus due to necessary movement or interaction outside the green zone, less oversight, and often large household sizes. Yeah, I disagree with this entirely. I don't think that's true at all. I think that it's easy to keep one person in a room and have one person, feed them. It's easy to create a situation where you're only in contact with one person, and just make sure that one person, washes their hands, in theory, wears a mask every time that they're bringing that person food and changing out their, chamber pot, I guess. Less oversight is the only thing they can really worry about, right? And of course, that's why they're trying to break up the families so they can have more oversight. And so remember, it says in here where this comes from, right? Okay. The premise is based on mitigation strategies used in the United Kingdom. So if you go down and look at the references, you'll find those, and I'll just have this one pulled up here. This is it. This is the same kind of document, but for the UK. Guidance on protecting people who are clinically extremely vulnerable from COVID-19. And what has changed? Shielding advice was paused on 1st April 2021. April Fools! So this didn't work in the UK apparently, or maybe it did, but they're no longer recommending it. So just think about that again, okay? This is still live for the CDC, but it is not in the UK. And for the references, just who are we dealing with, okay? United Nations, I gotta pull it up, sorry. United Nations High Commissioner for Refugees, okay? So it's a refugee group, but I'm just saying it's all the usual suspects, okay? UNICEF, World Health Organization, not sure who this is. Worry about the gender thing here from the UN. And that's just a little wrap up on that, okay? So just the usual suspects saying the same stuff. Some of it's reasonable. Some of it is the exact reason why many people died who didn't need to during the COVID-19 2020 version. So that's it for that video. Kept it mercifully short for y'all. Thank you to the person who sent that to me, or to the multiple people who sent that to me. And comment, share if you like it. Join the channel, please, and if you can support my work in any way, I would very much appreciate it. This has been Evan Benton of Dogg from Air. Thank you, and good night.